Here we go, chapter 12. Chapter 12 talks about the primary assessment. All right, what can you tell me about the primary assessment? What is the primary assessment?
Life-threatening.
Baseline vital signs.
No, not baseline vital signs. You're looking for life-threatening injuries or illnesses, right? Any complications with what? Airway, breathing,
ABCs.
circulation, ABCs, right? So when you have complications with airway, breathing, circulations is when we're assessing, or what it's called the primary assessment, the assessment of the ABCs. So there on page 283 under primary assessment, it says, the first element in the patient assessment, steps taken for the purpose of discovering and dealing with life-threatening problems, right? The 6 parts of the primary assessment is form a general impression, okay? And the general impression is how the patient looks. They look sick or not sick. Number 2, assessing mental status, do the NAFBU, okay? Are they alert? Are they alert to verbal? Are they alert to painful? Or are they unresponsive? Okay. The third step is assessing airway. Assessing airway. Fourth step is assessing breathing, and fifth step is assessing circulation. Okay. And determining the priority of the patient. Primary assessment also deals with determining if the patient is critical or stable, and determining if they're high priority or low priority. That's part of your primary assessment. So after ABCs, okay, and then you determine the priority of the patient. Okay. So approach to the primary assessment. Okay, let's look at those bullets there on 283. You are called to a responsive patient who dropped a concrete block on his foot and is in considerable pain. Would that be high priority or low priority? High or low?
Hi.
Why high? He's a responsive patient who dropped a concrete block on his foot and is in pain.
Oh, never mind.
Okay, he's responsive, his airway is intact, his breathing is intact, his circulation is intact, he just has pain due to the block that dropped on his foot.
His circulation could have cut off with the brick,
Okay.
multiple fractures.
All right, so we're gonna call that low priority, all right? So you are eating in a restaurant and absorb a man with what appears to be a complete airway obstruction. Now you have problems with airway, right? Because he's got an airway obstruction, so that would be a high priority. So that's what we talk about when we're looking at the ABCs. Is the airway patent? Is it open? Is it clear? Is the patient breathing? And is there circulation? As we move on to page 284, we look at the next bullet. You arrive at the side of a patient who had passed out and is now moaning. She has vomited. High priority, low priority?
High
Is there a
priority.
problem with airway?
Yes.
Yes, because they have vomiting, they're unresponsive and is moaning. The next one, you are called for a man down and see a person on the ground who does not appear to be moving or breathing. High priority?
High
High
priority.
priority because he's unresponsive. We don't know if he has airways intact, is clear, or if he has breathing, until we assess him further. So that would be a high priority patient. Next one, you are called for an industrial accident and find a man who looks pale, sweating, and about to pass out. He has blood spurting from his thigh.
High priority.
High priority. He has a circulation problem. He's bleeding out from his thigh. He probably has a femoral artery that's torn and is bleeding profusely. All right, so when we're making the decision in the primary assessment, we have to assess airway, breathing, circulation to make the decision whether the patient is high priority or low priority. Okay, so a patient with airway compromise or airway blockage, vomiting, or has breathing problem, is choking, has a partial or complete airway obstruction, then we have a problem with airway. A patient that's bleeding, then we have a problem with circulation. So if you have a problem with ABCs, then we cannot move further in any type of assessment until we fix A, B, or C, until we fix airway, breathing, and circulation, right? We cannot go to assess his vital signs, to go assess his head-to-toe evaluation or any of that until we complete and secure airway, breathing, and circulation, okay? During the primary assessment is when you're going to administer oxygen. After you assess breathing, airway, and breathing is when you're going to apply the oxygen. Let's say, for example, the patient is conscious but is having trouble breathing, right? And we consider it a high priority. That is when we apply the oxygen. We don't apply it once we get to the ambulance or to the hospital. We apply it as soon as we identify a problem with airway and breathing. Okay, so there on 284, it has some bullets under decision making in the primary assessment, and it gives you some examples of problems with airway, breathing, and circulation. So when we're performing the primary assessment,